Mr. Schaefer. I'm Dana. I'm a registered nurse.
Hey, how are you?
I'm good. Just wash my hands. Best way to prevent infection. I'm going to be doing an assessment of the musculoskeletal system and cranial nerves today in your abdomen. It'll probably only take about 20 minutes or so. If you have any questions, you can feel free to just ask me throughout the assessment.
Okay.
And we keep all things private here with regards to your information. So I'll go ahead and pull the curtain here for extra privacy.
Okay.
We'll get started with the cranial nerves. We have a few tests that we'll be performing here. The first one is the cranial nerve number 1. It's the called the olfactory nerve, and it tests your sense of smell. So let me have you close your eyes, and I just want you to tell me what you smell.
Peppermint.
Okay, that's correct. I'll also take my light and just look in your nares and make sure they're patent, and they are. Go ahead and just hold one side of your nostril and breathe in, and then the other side. Okay, great. So olfactory nerve, cranial nerve number 1 is intact. Secondly, we'll test the optic nerve, or we're going to talk about the optic nerve. That's cranial nerve number 2. That's where you would use a Snellen eye chart from 20 feet away, and you would read the smallest line that you could. You would cover your eyes one at a time accordingly. We don't have an eye chart, so we're not going to do that. And next we would test the 3, 4, and 6, which is oculomotor, trochlear, and abducens. And there's several eye tests that we would do there. We're checking extraocular movements. So I would have you look at my pen and just move your eyes, follow my pen from side to side. Okay, good. And I'm going to shine a light in your eyes. I'm just checking for the pupil accommodation to light. And your pupil size is about 3 millimeters, and I did accommodate with light. And let me go ahead and just have you follow my finger. Okay. So 3, 4, and 6 cranial nerves are intact. The pupils are equally round, reactive to light and accommodation. If I had an ophthalmoscope, I would look in your eyes and look at the fundus and whatnot. Next, we'll check the trigeminal nerve, which is the sensation of the face. Will you clench your teeth for me? Clench your teeth. Okay. I'll do that again. And so I'm palpating the temporal and the masseter muscles while he does that. And they're both equally strong bilaterally. Also, with that test, we'll just also test some sensation. Close your eyes. Where do you feel me touching?
Left cheek.
Okay, where now?
Right forehead.
Okay. So cranial nerve number 5, trigeminal, is intact. Next is cranial nerve number 6, which is the abducens. Oh, we already covered that one in 3, 4, and 6, sorry. Cranial nerve number 7 is the facial. So we're looking for symmetrical facial expressions. Smile for me. Okay, show your teeth. All right, I don't see any drooping, and his nose and lips, mouth, eyes all look symmetrical and equal, no drooping. Cranial nerve number 8, which is the auditory, can also be called the forgot the other name. Auditory. So I will whisper a 2-syllable word. I'll have him cover one ear at a time, and he'll tell me what word he hears. Cover your right ear.
Baseball.
Actually, we'll stand this side.
Baseball.
Okay, and cover the other side.
Strawberry.
Okay, that was 3-syllable, but you still did a good job. So I'll also take my light and I'll look in the ear canals And I'm looking for wax and lesions in the ear canal, and everything looks fine there. So I would also look with an otoscope if I had one, and I would look for any type of fissures or whatever. There's no piercings noted in either ear. Next would be the cranial nerve number 9, which is glossopharyngeal. And I would be looking at his lips, which are pink, moist. Open your mouth up. Stick out your tongue. Okay, say ah. Okay, good deal. So I didn't see any edema in the gums. The mucosa is clear. No edema, no missing teeth. He doesn't have any tonsils to note. I would also look at the pharynx, and I would look at the uvula. Do that again. Okay, and the uvula is midline and does not deviate from side to side. Number 10 is the vagus nerve. Swallow for me. Okay. And he already stuck his tongue out, and it was midline. So number 10 vagus nerve is intact. And then the spinal accessory would be testing the shoulders. So shrug your shoulders. Okay, now do it against resistance. All right, turn your head. Try to resist, and other side, resist. All right, so that's testing the trapezius and sternomastoid muscles, and they're both symmetrical. No crepitus noted, full range of motion. And then number 12 is the hypoglossal, which was the tongue midline, and that is intact. I apologize for that, Mr. Schaefer. I had to make a stop into the pediatric ward. I had a little one over there that was pretty upset. So we'll continue with the assessment right now. We'll go ahead and do some different neurological tests. One is called the finger to nose test. So I'm going to move my finger to different places, and I want you to follow it and then touch your nose. So we'll start right now. So put your finger up to mine and go touch your nose. Okay, good deal. Next we'll do the heel to shin testing. So you're going to take your right heel, run it down your shin all the way to your big toe, and then the opposite side. Get on up there, Mr. Schaefer. A little bit higher. There you go. All the way down the big toe. Good deal. All right, and then we're going to do a test called the rapid alternating movement test. So what you're going to do is take your hands and go like this as fast as you can. Okay, good. And then we'll also do one with the thumb to fingers. As fast as you can. So it's like, do like this. Okay. And then do the other side. Do like this. Okay. Perfect. All right. A couple more things using the hands. Let me have you close your eyes. I'm going to place something in the palm of your hand, and I want you to tell me what it is, just by touch, just by feel, okay? You can use your other hand to feel it if you need to. Paperclip, correct. That is light touch proprioception, and then this test here is 1 and 2 point discrimination test. So just close your eyes.
Okay.
I'm going to touch your different places of your hand, and you tell me if you feel 1 or 2 touches, okay? And it is kind of sharp, but you feel 1 or 2 things.
1.
Okay, now
Good.
Okay. And now.
1,
Okay, and now.
2.
All right, good. Okay. Next we will. I'll pick out a couple of joints and just assess them, and I think I'll do your wrist joint. So I'll look at them bilaterally and just kind of bend them. All right. And they both look equal. No swelling, no warmth or redness. And it appears that he's got go like this, that, extension, flexion, go side to side, which is adduction, and then abduction out. And he's got full range of motion in his wrist bilaterally. Next, let me have you stand up. All right. And then I want you to continue standing and just close your eyes. And this is called the Romberg test. And you would stand for 30 to 60 seconds with no support. And we'll pretend it's been that long and you did fine. You can go ahead and you can sit down now. So you passed that test. We'll go ahead, I guess you can stand back up. We'll go ahead and assess your gait, your stance. So walk, so you're in the camera's view, walk this way. Okay, so he's got a steady gait. Good. Now walk back this way, heel to toe. Nice and steady. Good, he's able to do that perfectly. All right, and then can you walk on your toes? Good job. And are you able to hop on one foot? Other side too. Okay, and then can you bend your knee? And then other side. Okay, good. Next, you can go ahead and sit back down. I'm going to test the muscle strength in your arms, so in your fingers and your hands. So First off, let's just start by having you squeeze my fingers with your hands. Squeeze. All right, nice and strong bilaterally. Try to resist against me. Good, nice and strong there. And again, and then other way, try to force down. There we go. All right, so he's nice and strong bilaterally with his fingers, hands, and arms. Actually, we hadn't done the hands yet. Okay, make a fist. All right, and just, I'm going to try to undo the fist. Nope. All right, nice and strong. Okay, so arms, fingers, and hands, strong bilaterally, no problems whatsoever there. Now we will do range of motion on the hips, knees, ankles, and feet. So we'll lay you down last. So for the feet, go ahead and do plantar flexion, which is down, okay, and then extension would be up, good, and then you would do inversion, which is in, bend your foot in, and then eversion is out, good, and then do the other side. Okay, good. And then next we would do, so that covered the ankles. Are you able to spread your toes for the feet? I can see through your socks there. Okay, good. And then let's see, your knees. Actually, go ahead and lay down. Lay down on the table there. And are you able to bend your knee? Okay, and then other side. Are you able to go out, out, and then cross it over? Okay. So that is, you flexed it and then extend it. Okay, and then extend. So we've done, there's a little crepitus there in that right knee. So we've done extension, we've done flexion, adduction was in, and then abduction was out. Also part of the hip range of motion was going into your chest, which you kind of already did there. So that's hip, and then hip over, and then over, kind of stiff there. Let's see here. Go ahead and stand back up for me. All right, also some hip exercise or range of motion. So you could do out to the side on both sides. And then go forward. And then back. Okay, good. So that would be, we did the flexion in towards the abdomen, and then extension, and we've done over and over, which is adduction and abduction. Go ahead and bend over like this. I'm going to take a look at your spine. And so it appears to be straight, midline. I do note a couple of scars back here. You had back surgery before?
Yes.
Okay. And then we can check your shoulder range of motion and your neck. So go ahead and bend your neck side to side. Okay, and then extend it back and then flex forward. Okay, good. And then on your shoulders, act like you're gonna pop your back or something like that, side to side. And that also works your spine there. Okay, good. All right, and then your arms, flex, extend, other side, and then pronation is this way. Do this with your arms, and then flip them. Okay, for supination. Good, and you can put them down now. Are you able to spread your fingers? Okay, and then put them together. Okay, and we already tested the wrist. Whenever when I was testing for inflammation, I did. Okay, and then if you lay down, we'll go ahead and inspect your abdomen too. So have a lay down there on the table. Okay. Now raise your shirt. Looking from the end of the table, there is no notable paralysis. None noted there. Intangible lighting. And I'm going to listen for bowel sounds. I would listen in all 4 quadrants, and I should hear 5 to 30 bowel sounds in 1 minute. Okay, so he has active bowel sounds in all 4 quadrants. And I would just do some palpation. Is any of that tender, Mr. Schaefer?
No, ma'am.
Okay. And then I will name organs in each, 1 organ in each of the 4 quadrants. So in our right upper quadrant, we would have the liver. In the left upper quadrant, be the stomach. Right lower quadrant could be the right ureter. And the left lower quadrant, the left ureter. Or sporadic cord, right or left, whatever. But anyways, those are some organs in all 4 of the quadrants. Let's see. Oh, your umbilicus is inverted and your stomach is flat. And convex, and there's no visible lesions. Striae, there's a scar here. Can you tell me what that was from? Okay.
I'm not sure.
Oh, okay. A little scar there. No telling. All right. But other than that, no lesions. Everything looks good. You want to sit on up? That concludes our assessment. Do you have any questions for me?
No, ma'am.
Okay. Thank you very much.
No, thank you.
Oh, no. Thank you.